right, welcome back to Pharmacist on Call. Your host, Dr. Shawn Pruitt. Your doctors are busy, your pharmacists are busy. They don't have time for this hour. I do. So call in with those questions and those comments. We're going to get right back into your calls. So we've got Margie. Welcome to Pharmacist on Call. How may we help you?
They don't have time this hour.
Hello, Margie. Margie.
Yes.
Yes, ma'am. How may I help you?
Yes, Dr. Pruitt. I have some questions about an SSRI that's called, I guess, citalopram.
Yes, ma'am.
I would just like to know some of the side effects of that, whether or not it affects your weight or, you know, gives you an unnatural look, you know, like maybe you're retaining fluid.
The citalopram, I would think that the main one is a stomach upset. But I think that what can happen, because your serotonin is up, actually one of two things. So you could either go down in weight because you now feel better and you don't feel like eating anymore, you know, so you eat because you were depressed. Or because you feel much better now, you have an appetite and you want to eat. So I think it just depends on which cycle of serotonin that you've got going on.
Okay. It's not me, you know, it's someone I know who has been taking this for quite some time, and she just doesn't have a natural look and looks like she may be retaining fluid. But
now make sure she's not on one of the other mood stabilizers. Now they do increase weight, so things like your gabapentins, your carbamazepine, things that they would use for bipolar disorder, which is probably certainly reasonable since she also has depression. So if she's, you know, something like haloperidol, something like Seroquel, all of those do increase weight.
But this shouldn't.
The citalopram, no, I would not think so.
Okay. Well, if she wants to come off of it, how would she go about doing that? Just gradually? Or?
Yeah, she would need to taper down off of it. So that she and her doctor are going to have to discuss.
Right. Okay.
Yes,
well, thank you so much.
Yes, ma'am. Thank you.
Bye-bye.
All righty. Bye-bye. Barry, welcome to Pharmacist on Call. How may we help you?
Yes, sir. I just had a hernia surgery on the 8th of this month.
Okay.
And then one side of my stomach is like back to normal, but the other side, like, it swells up on me, and it gets real hot. And then also, since surgery, I'd be having these cramps at night in my legs and in my hand. I mean, they hurt so bad, it's crazy because I'm not used to having them. So, what do you suggest?
First, I think you may have an infection setting up on that other side there, especially since you're telling me it's swollen, and it's also really warm down there. So have them look at that, make sure it hadn't gotten infected. In terms of the cramping, I'm kind of at a loss, is what it could be. I mean, my first guess would be to ask you, are your potassium levels okay?
I can't say because I really don't know, you know, because I've had, like, last year in April, I had 2 surgeries back to back because one surgery that I had, and I stayed in the hospital for 10 days, it was a hernia, and they did something wrong. I stood up and couldn't stop throwing up, so I had to go to a CAT scan, and then they said I had to have another surgery ASAP because something came unraveled. And so, but when they did that one, they didn't fix the hernia. So my intestines was getting stuck in my muscle, and there was tremendous pain. So I went to this other doctor, and they just did another surgery on me on the 8th of this month to fix the hernia that they didn't fix on those other 2 surgeries last year.
Maybe time to consult an attorney, man.
Yeah, but then you know when you go to them, when you go to them hospital, doctor, and you sign so many papers, then you don't know exactly what you're signing. So.
Yeah, I mean, you've paid them, so I would have them go and take another look in there, let them know what these complaints, especially with the cramping, that should not be going on. But I think that we probably have an infection setting up on the other side of your stomach there.
I pray to God it's not. But they said, I called them and they said that because they put a mesh in there. And they said there was a lot going on down there because they said there was a humongous hole down there. That's why my intestines kept getting stuck in my muscle because the other surgery I had, they didn't fix the hernia.
Okay.
So they were saying that it was normal, but it don't seem like it ought to be normal though, because like I say, it gets so warm and hot in that area, and then it just starts to sweating again.
Okay, yeah, so then I would go see them. I think you're going to need a round of antibiotics to get rid of, especially since you told me there was a hole there and your intestines was kind of blocking it. So, yeah, that definitely makes me think an infection is set up in there.
Okay, I thank you, Dr. Pruitt. Thank you very much.
Yes, sir, thank you. All right, good luck, man.
All right, bye-bye.
All right, bye-bye. See, Marie, welcome to Pharmacist on Call. How may I help you?
I thank you, Dr. Pruitt. Thank you very much. Yes, sir, thank you. All right, good luck, man.
Hello, Marie.
Hello.
Yes, ma'am. How may I help you?
Yes, Dr. Pruitt. I have recently been diagnosed with diverticulosis. What is there natural that I could do to get this done?
Diverticulosis, I would think maybe our Kangen alkaline water and probiotics.
Probiotics? What's the difference between probiotics and antibiotics?
Well, the probiotics they're actually natural bacteria that colonize the inside of our gut. They will get rid of the bad bacteria that's down there. Antibiotics are something unnatural used to kill, everything.
Okay. Is it possible to get rid of the pocket-like sacs that's in the colon?
I think that's a surgical question and probably beyond my scope of knowledge. That one I cannot guess on.
Okay. What's one of the best remedies for high blood pressure?
Hypertension, I would say this right here, our beetroot juice, a hot seller. So it opens up those vessels and allows the heart to stop working as hard as it normally does. So I would say our beetroot juice, just one little capful in the morning on an empty stomach, and your blood pressure is going to come down in about 20 to 30 minutes, most people say.
Okay.
Also great for diabetes, cholesterol, low iron, gout. So
do y'all carry the probiotics there at the pharmacy?
We do. We have two kinds. Dr. Langer's is the one we sell most of, and it's about a 16 strain, has 16 different strains of lactobacilli, or different 16 strains of probiotic in it. So, and those run about 16 to 17 bucks.
Okay. And the water is how much a gallon? It is
$3.50 a gallon, or if you have your own container at home, you bring it in, we'll fill it up for $2 for every gallon it holds.
Okay. Okay, then. I appreciate your time.
Yes, ma'am. Thank you for your question. All righty. Beverly, welcome to Pharmacist on Call. How may we help you?
Good afternoon, or good evening.
Good evening.
I have two questions, really. The first one is, do you have anything that I could use for athlete's foot that would be effective on that?
Athlete's foot, I would use one of the dry sprays, so something like a Tinactin, a Mycotin, or clotrimazole. They go on as a cold, dry powder. Do not use the creams and the ointments because that's just messy and yuck. But use one of the dry powders and it'll try to keep your feet dry throughout the day, even when your feet are sweating. It should begin to get rid of that fungus in about 2 to 3 days.
Okay, okay. Yeah, my husband has a lot of muscle pain and numbness in his feet. Would you have anything for that? I have a bottle of the CBD oil. Would that help?
Well, let's get to the root cause. Is he diabetic?
No, he is not.
Okay, okay. So yeah, the CBD oil would help. Is he on cholesterol medication?
Is he on what?
Cholesterol medication for his cholesterol?
Not. No, he's not.
Okay, so yes, ma'am, the hemp oil, the black formula is what I would recommend. It's the most concentrated form, and it is what we use primarily for pain and anxiety. So a few drops under the tongue, you'll be a new man.
Okay.
Now, did you get this brand? Did you get it from us?
I did.
Okay, okay. Yeah, so start him out with about 5 drops or so, and yeah, let him rip.
About 5 drops in his tongue, right?
Yeah, now he can go up from that, excuse me. So, you know, everybody's dose is going to be different. He may need 10, he may need 15 until he gets to that dose that he needs. You know, just kind of play around with adding more drops daily.
Okay. Would that have any adverse effects to it?
Adverse effects, most people have complained about feeling much better.
Oh, okay. Well, I can take that adverse
Yes, ma'am.
effect.
Yes, ma'am.
All right. I'm also an alumnus of APSU, so go P.
Okay. All right. What class?
93. I don't know if I'm a bit younger than you.
Well, yeah, you about a year after me. Yeah. Okay.
Oh, okay, 93.
Yes, ma'am. Okay. All righty.
Okay.
All right. Well, all right, Gov.
Okay, thank you.
Yes,
Go
ma'am.
Gov.
Okay. All right. Thank you.
Thank you.
All righty. Bye-bye. Let's see here. Alicia, welcome to Pharmacist on Call. How may we help you? Alicia. We're on time delay, everyone, so that's why it's taking a second. Alicia? Alicia going once. Alicia going twice. All right, let's see here. Pharmacist on Call, how may we help you? Hello, Millie? Hello? Y'all getting shy now? Welcome to Pharmacist on Call, how may we help you? Welcome to Pharmacist on Call, how may we help you? Hello? Okay, all right, I guess everybody's phone is on mute, but I guess what? We will be right back. You stay right there. We'll take another commercial break here.